And back in the studio, we are talking with Dr. Alan Goldenhar of the Memorial Hospital Wound Center. Thank you for joining us.
Thank you for having me.
The Mount Washington Valley, the White Mountains, such a great place to get out and recreate, but of course hard to do if you're not in good health, if you've got some health issues. And here to talk about a new facility at Memorial Hospital.
That's correct.
Is Dr. Goldenhar. So it's the Memorial Hospital Wound Center. Am I saying that right?
It's actually going to be called the Wound and Hyperbaric Medicine Center at Memorial Hospital.
And what is this new center?
Basically, the Wound Center is a multidisciplinary facility which is going to be dedicated to treating difficult to heal wounds.
And this is this new technology to the area? Because I'm always impressed at the new facilities, the technology at Memorial Hospital. It really is becoming a state-of-the-art facility with state-of-the-art medicine.
Absolutely. This is a brand new service we're offering, and we're doing this because the nearest wound care centers are currently located in Portsmouth or Portland.
Yep.
Now, for patients who have slow-healing wounds, diabetic wounds, and who are often not in the greatest of health, going to a wound care center which is 75 to 80 miles away is a long trip. And if you do that every day, it can be very fatiguing on the patient. So this will be a new service which hopefully will benefit the entire community.
Okay, now so examples of some of the wounds or injuries that you would treat here: diabetic foot ulcers, and what was the other one we mentioned? You mentioned
venous leg ulcers.
Venous leg ulcers. So what are these, and why is it important to come see you right away?
Probably the most common problem we will see at our wound care center is a diabetic foot ulcer. Diabetic foot ulcers are fairly common in patients who have diabetes for a longer period of time, who may have poor circulation, which makes it difficult to heal, or they have problems feeling their feet, and that's called peripheral neuropathy. And the problem occurs if a patient has peripheral neuropathy, difficulty having sensation in their foot. They might not sense an initial injury. They might get a foreign body in their foot. They might get something as simple as a callus, which then becomes infected. And if they can't feel it, it causes a hole in the foot called an ulcer. If they don't have the circulation to heal that ulcer, it can become chronic, very difficult to heal. Now, the problem occurs when that ulcer becomes infected. And if it becomes infected, the infection can get into bone. And if that happens, it can become a limb-threatening or even a life-threatening situation.
So we could be talking amputation, or worst case scenario, even death from something like this.
Absolutely. And the problem with amputation is statistics show that if a patient has an amputation of one limb, they run about a 50% chance of having the other limb amputated within 5 years. And the problem is with diabetic foot ulcers and ultimately amputation is it's a tremendous cost to the medical system. Mm-hmm. Number one, in terms of rehabilitation. Number two, in terms of lost income. So that's why, number one, it's important to prevent these things to begin with. But if they happen, to get them healed in the most rapid, expedient manner as possible.
And one of the newest ways to treat this is available at the Wound Center at Memorial Hospital. It's a hyperbaric oxygen therapy. Tell me about that.
Hyperbaric oxygen, basically the science behind it is having the patient breathe 100% oxygen. If you breathe 100% oxygen, it has been shown that, number one, you can increase the number of blood vessels in a wound. Number two, you can change the chemical makeup of the wound itself. So you can change a wound that is healing very slowly, and by increasing the circulation into that wound site, you can help it heal more rapidly. When a patient goes into the hyperbaric tank, they're basically sealed into the tank. and they will gradually, it's called a dive because it's very, very similar to a deep sea dive. You and I are sitting here at what's called 1 atmosphere of pressure. When we put the patients into the hyperbaric oxygen tank, they're basically be taken underwater to about 45 feet below sea level at about 2 atmospheres. And they breathe the 100% oxygen probably for about 90 minutes, and then gradually they're brought back up to sea level. So the science behind wound healing with hyperbaric oxygen is very, very well established. It has a lot of what we call evidence-based medicine behind it, and it's been shown to heal these wounds.
So how does this affect long-term treatment? How many treatments should someone expect to go through in trying to either cure or better their ailment?
Chris, that's a good question, and the best answer is it all depends on the wound. Diabetic foot wounds probably require 5 days a week of 90 minutes apiece for about 4 weeks.
Oh.
So it's quite an extended treatment schedule, but it also requires that the patient be committed to that treatment schedule. And the good news is most of these patients are, because they are really at the end of their treatment rope. They do not want to lose an extremity.
Right. What is some of the feedback you're getting from your patients who are undergoing this for the first time? Are some of them nervous about undergoing this kind of treatment because you have to go in the chamber?
Well, we haven't opened yet. That's July 18th. So we haven't had any feedback yet. That's our first day of opening.
What feedback do you think you'll get?
Typically, when a patient goes into a hyperbaric chamber, they really feel nothing. They might feel a little bit increase in warmth in the chamber, but basically it's a painless situation. Occasionally, a patient will get some fullness in their ears. And the best way I can explain that is think of when you're on an airplane.
Yep.
Coming from 30,000 feet, your ears start hurting possibly. What we do to ease that is we stop the dive, let things ease off, and then continue it. But basically, it's just an increase in temperature.
All right. How does someone, I guess, get more information or even start the treatments? Does it begin with a visit to your office?
Not a visit to my office. Basically, they can call the Memorial Hospital, and there is a number for the wound care center at this point. They can either come in through referral or probably just make an appointment by themselves. But that's how the treatment starts. They don't come in through my office.
All right. And do you know the question a lot of people have when undergoing a new treatment, is it covered by insurance?
That's a good question. Most treatments, most visits at the wound care center are covered by insurance. However, each patient is different, and we have people who will work with the patient to determine what the coverage might be. But most treatments, including Medicare, and that's probably our largest number of patients, they tend to be the older population with these wounds. Yes, they are covered through their Medicare.
So you definitely need to at least look into it to see what is covered, because this is founded on science, on medical science.
Absolutely.
This is not really an alternative therapy.
No,
it's just state-of-the-art therapy.
No, it is not alternative therapy at all. It is the best therapy we have to offer. And it's not only hyperbaric medicine we're going to be using, it is different treatment modalities, including different types of dressings, offloading the foot using total contact casts. We'll be working in a multidisciplinary approach using physical therapy, diabetes nurse education. It's a quite extensive initial intake interview, probably an hour or so, to find out why the wound developed, your past medical history, that type of thing, before a patient even starts treatment.
All right. Dr. Alan Goldenhar of the Memorial Hospital Wound Center, which is about to open. When is it?
July 18th is our first opening day. The hyperbaric tanks are rolling in on Tuesday.
Will there be balloons?
Balloons, yes, we will put them in the tanks and pressurize them.
Even the balloons are healthy at Memorial Hospital. Well, there's probably so much we could get into that we don't have time for. If people want more information, what's the best way to get it?
The best way to get in touch The Wound Care Center number would be 356-5461, extension 3400. That is our dedicated number right now.
All right. Well, we're looking forward to this new service coming to the Mount Washington Valley, courtesy of Memorial Hospital. Dr. Alan Goldenhar, thank you for joining us.
Thank you for having me.
And we'll be right back to wrap things up here on White Mountains Today.
Tried everything for dark circles?
Try this.
Skin Renew Anti-Dark Circle Roller. The first 2-in-1 eye roller. Refreshing eye care with caffeine.